Our questionnaire was administered to patients in our study, so it's looking at patients wearing the treatment patch versus the placebo patch. And one thing that seems to be nice about the patch is it's a simple approach. There's no real updosing with it. The patients in the trial, the first patch is placed in the office, and then after that, patients ramp up their dosing at home over the course of a few weeks. They're then wearing it 24 hours a day. They came in for the study to be checked on and have blood tests drawn and as part of the clinical research. But it's generally a pretty convenient approach. There were no restrictions around activity or illness, so it seems to fit in well with the lifestyles of families, and I think that's supported by very high compliance rates of the high 90%, generally low dropout rates we've seen in our various trials, typically around 10% dropout, around 1% dropout due to adverse events. So it's generally a well-tolerated therapy, which we think is a big part of the quality of life improvement. We know from talking with families as well as from our studies that what many people are interested in is increasing their sensitivity or decreasing their sensitivity by raising how much they can ingest before seeing a reaction. So most patients, this is not to say all, but many patients are not interested in freely consuming peanut butter sandwiches or foods with peanut butter in them. They just want to be reassured that when they go to a party or a sleepover or a restaurant that they're not going to accidentally come across something that's going to trigger a reaction. So this is all about trying to essentially have sort of a seatbelt or safety buffer. So still the same avoidance and epinephrine access precautions are in place, but hopefully families feel better by knowing they do have that buffer of protection. And it's nice to have the data with the quality of life questionnaire to show that we do actually see that during the study.